Hello everyone. So today we will talk about phylloid tumor. Okay. So phylloid tumor is basically much less common than fibroadenoma. So we have lastly discussed fibroadenoma, which is most common benign breast lesion. Okay. So first of all, phylloid arises from intralobular stroma. Now we all know what is intralobular stroma, between the lobules of breast. Okay, as mentioned in this figure. Now, what are the clinical features? So, it mainly occurs in the 6th decade of life, and a patient will present to you with painless palpable breast mass. Okay. Now, this is the photo of the phyllodes. Now, what is the gross feature? So, grossly, it will be much larger than fibroadenoma. It will be fleshy, and on cutting open, we can see that there is leaf-like or slit-like spaces on the cut surface. Okay, as mentioned in this figure. Okay. Now, microscopy. So, in microscopy, we can see that there is leaf-like epithelial pattern and there is stromal cellularity. Okay. Now, based on stromal cellularity, we can divide it into the benign, borderline and malignant. Okay. So, how we can differentiate it at these three? तो उसके लिए there are 6 points. Okay. So, first is stromal atypia, which will be mild in benign, moderate in borderline and marked in the malignant. Okay. So, we can divide it like benign, borderline and malignant as mentioned in this table. Okay. So, first is stromal atypia. Then second is stromal cellularity, which will be increase, mildly increase, moderately increase and markedly increase and diffuse. Okay. Benign and borderline, it can be focal. Okay. But in malignant, there will be diffuse increase in cellularity. Okay. Now third is stromal overgrowth, which will be present in malignant while absent in benign. Okay. Or absent or focal in the borderline. Fourth is mitosis. So mitosis will be less than 5 per 10 HPF in benign, 5 to 9 per 10 HPF in borderline and more than 10 per 10 HPF in the malignant. Okay. Now fifth is tumor border. Okay. So it will be well defined in benign, focally permeative or well defined in borderline, and it will be diffusely permeative in the malignant. Okay. And last is heterogeneous malignant कंपोनेंट. ओके. हिटेरोजिनस हम किसको बोलेंगे कि ब्रेस्ट के अलावा वाला कोई कंपोनेंट है और वो भी मेलिग्नेंट, then that is heterogeneous malignant component. If it is present, then we have to mark it as malignant. Okay. In benign and borderline, it will be absent. Okay. अगर heterogeneous malignant component हमें दिख गया, then it will be malignant. Okay. फिर बाकी के points का होना जरूरी नहीं है, पर अगर heterogeneous malignant component है, then we have to give it as malignant phylloid. Okay. So whenever we give phylloid report, then we have to give it like benign phylloid or malignant phylloid or borderline phylloid tumor. Okay. Bye.